Consider multiple myeloma, a type of bone cancer that impacts Black Americans at a much higher rate
Yes,
than whites.
it's a well-established fact, and I've known about this, and the medical community, oncology community, has known this for quite some time now.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold press juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello, fam. All right, this is exciting that you are joining me here on Cold Press Conversations. I am Dr. Jewel White Williams. I am the host of Cold Press Conversations, and it is brought to you by Black Tie Legacy. We are always delving into research, instruction, and clinical practices. And what's happening today in this particular episode, I am bringing to you Dr. Fitzroy Dawkins. He is a multifaceted professional in the medical field, blending the roles as a medical oncologist, hematologist, and biotech executive and author. Now, with over a decade at Howard University College of Medicine, he included leadership as an interim chief of hematology and oncology, and he later ventured into pharmaceuticals, contributing significantly at Johnson & Johnson Pharmaceuticals and Janssen R&D. At Incyte Corporation, he spearheaded numerous clinical trials and played a pivotal role in the development of ruxolitinib, the first FDA-approved drug for acute graft versus host disease. Now, one thing that is amazing about Dr. Fitzroy Dawkins is that he redirected his focus to pharma therapeutics, aiming to impact clinical trials in the African American community. Particularly, he focused on sickle cell disease and prostate cancer. But throughout his career, he has just been a vocal advocate enhancing clinical trials for cancers prevalent in the marginalized communities and for increasing the representation of Black physicians in this endeavor. Now, Dr. Dawkins holds his MD from Jacobs School of Medicine and Biomedical Sciences. He has authored this book, which we will be discussing quite frequently. It's called Fighting for Survival, Conquering Cancer and the African American Patient. And I'm telling you, when we delve all the way into it, you're going to be like, I've got to get this book. But before I hold you any longer, I'm going to take you right on to Dr. Fitzroy Dawkins, who is currently serving as a principal clinical consultant with Eloquent Life Sciences, and enjoy this amazing interview. Take care. Hello, my name is Dr. Jewel White Williams, and I am thrilled beyond measure to have Dr. Fitzroy Dawkins with me today on Cold Press Conversations. He is an amazing physician who is a medical oncologist, hematologist, biotech executive, and book author. And I have him here with me today, and we're going to delve into so much. I'm going to be really honest with you. I am going to be using my own personal knowledge. I'm going to be using Dr. Dawkins' information from his book. His book is about fighting for survival, conquering cancer, and the African American patient. But what he has within it, okay, I'm not going to delay us anymore. Dr. Dawkins, how are you doing?
I'm doing very well, thanks, Dr. Joel. Thank you so much for having me on. I really look forward to our conversation today. You've been very kind with your welcoming words, so thank you so much.
I'm telling you, I'm a reader, so I have to be careful about what I say. But I believe even if you do a slight skim, and I read a lot of his book in less than a 24-hour time frame, because it piqued my interest. I'm a person who enjoys research. I'm a person who enjoys science. And I enjoy someone who can write eloquently in a manner which will appeal to the average soul. But there's something I want to start with. He and I were just talking, just casually, about disparities, about knowledge, about informing community. And this particular episode will have a sway toward the African American community because he wants us to understand that we're trying to meet some of the needs. I'm going to start off with this one thing. It's called group think. And according to groupthink from Dr. Dawkins, it says the Encyclopedia Britannica defines groupthink as a mode of thinking in which individual members of small cohesive groups tend to accept a viewpoint or conclusion that represents a perceived group consensus, whether or not the group members believe it to be valid, correct, or optimal. I gotta say, your example of groupthink using a friend of yours about how they thought their daughter had that groupthink,
Yes.
could be a lawyer,
Yes. Yes.
and she went a different direction.
Yes. 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 I want to thank you for that, because if you read nothing else in the book, if you do get the book, that is the essence of the message I'm trying to get at, and an attempt to change the trajectory of the way we in the African American community think about health, and in particular think about cancer. So basically, the story here, for those who have not read the book, is of a friend of mine who had a daughter who was told, this is at a high level, by her teachers, that she would make a great attorney. She was in the seventh or eighth grade at the time. And so she bought into that. She was very verbal. She was very assertive. She was very confident. And she bought into that all the way through to college. And her family bought into it. It made sense to them. She had an aptitude, they thought, for it. And from the dad's standpoint, he thought, you want to be an attorney. Attorneys usually do well in society. And it makes sense. If you have the aptitude, you have the drive, and you have a potential profession that can give you a reasonably good standard of living, why not? So everything that the family did for her was to encourage her in that direction. She goes to college and she begins to think. And she begins to think. And she's thinking first year, second year, third year of college. And she comes home and she says, Dad, this legal thing, I don't think I want to do that. And her father almost fell off his chair. He didn't understand, didn't make any sense. Because in his mind, he understood what it possibly could mean for her life and her family's life if she became an attorney. And they had a fight. They had a big blow up because she says, I am not going to law school. And here are the reasons why I'm not going to law school. Not to put law down, I'm just saying this was her perspective. And her dad says, you have lost your mind. But she says, Dad, I'm going a different direction. I embrace why you want me to be a lawyer. I understand you wish the best for me. But for me, despite what the general public may think about lawyers and how well they do, I want a different direction. And she fought with her dad and she broke the mold. She said, I'm going to go to business school. That's where I want to go. And eventually, her father embraced the fact that this was her path that she needed to take, and she has done well by it. But had she followed his recommendations, the outcome could have been different, because she talks about the negative aspects of law. And her father wasn't thinking that. He was thinking a good living, sacrifice perhaps, but a good living. So I thought that story sort of helped us to think a little bit more about how we can think differently and still be successful and still come out of this. And I applied that to the business of how we as African Americans think together, and sometimes very successfully and well. But sometimes we need to break the mold. And I think that the area of clinical research and cancer is one of those areas where I think we need to break the mold. We need to think differently. We need to step outside and perhaps lead the rest of the African American community to a better day.
So I wanted to bring that up first because one thing that I have noticed, because I do have a daughter and I watch her friends, their thought process, and even for me, I think we have changed from way my mom and my dad and my grandma, when someone got something, said they were something, they just fulfilled it because they felt that they were the wise ones and knew, regardless of whether or not it was something that was in their true birthright of doing something that would be optimal for them to do.
Mm-hmm.
And what you did is let us know that groupthink is okay to do something that may not be in what others perceive as our best interest, but where we may find our own excellence.
Yes.
Or where we have our opportunities to do best. And I think that's the direction we are trying to go. You mentioned something in regards to multiple myeloma, and I'm trying to make sure I have it right. You stated that the advances in managing patients diagnosed or at risk for cancer over the last 50 years have been breathtaking. Today, Black Americans can help shape their health narrative. The opportunity is unprecedented. Consider multiple myeloma, a type of bone cancer that impacts Black Americans at a much higher rate than whites.
Yes. It's a well established fact. And I've known about this, and the medical community, oncology community, has known this for quite some time now. I can talk a little bit more about it
Yeah.
because, again, I practiced at Howard for 15 years,
Mm-hmm.
and I give a number of examples in the book of patients at different stages of multiple myeloma, this type of bone cancer. And I tell the story of a man who, in his 50s, so multiple myeloma is a disease of the aged. You typically
Mm-hmm.
get multiple myeloma in your 60s, 70s, and beyond. And this poor man had spent 30 years, I believe, of his life working very hard. He wasn't, a college grad, and he worked very hard, and he decided that it was time after about 30 years to retire. So, assuming then that he starts at, say, 18, 19 post high school, he's working 30 years plus. And he says, I'm going to go to Atlantic City when Atlantic City was a place to go. And he got there, had a good time, and then developed severe pain in his bones. And it was weird. It was strange because he's not somebody who complained. He went to the emergency room in Atlantic City. They took some x rays. He came back home to Washington, D.C. with some pain medications. He came to see us. And it turns out that what he had, based on the x rays that he brought with him, and based on the bone marrow biopsy that I did to get at where the potential source of the problem was, since it is a bone cancer, you go to where the cancer is.
Yes.
And we extracted some cells. We looked at them under the microscope, and we saw that they had an abundance of something called plasma cells, distorted plasma cells. Now, we all have them, but these were very distorted. He was anemic, he was in pain, and I knew he was in trouble. And at the time, the life expectancy of multiple myeloma was about 3 years or so, maybe even less. It sort of bothered me, and still bothers me, that it is such a predominant disease compared to whites in our community. And we don't know why. We don't
Hmm.
know why. So he was younger than average. His symptoms were more severe at the onset. And ultimately, his outcome, his life expectancy would be substantially shortened compared to even with intervention, even with treatment. And we saw a number of patients like that, a lot of patients who came in at different stages with their disease. And one of the questions then that I think the scientific community, the medical community is asking is, why is there such a higher percentage proportionally of Blacks with this disease? And I don't think we know. There might be some scientific reasons for that. We think there are mutations that are associated with multiple myeloma, multiple mutations actually. Some seem to prognosticate perhaps a better outcome than
Mm-hmm.
others, but we don't know. So, my point of talking about this gentleman and others with multiple myeloma is we need to do a scientific deep dive to try and understand this. We may not be able to understand it by looking at the majority population if you have a 2-to-1 ratio. What is it among ourselves? Is there anything among ourselves that predisposes us to have such a disproportionate amount of this particular disease? And so, my point is, if you don't participate in the research that is being done, if you don't volunteer yourselves, if you don't demand that more trials are done in our community to try and sort this out, then it's kind of on us, right? It's not just about me, it's about my family. It's about the next generation. It is looking out for, 2 generations, 3 generations out where we might be able to have an answer. And then what we do in the biotech is you identify the problem, You identify the target where it can be treated, you design a treatment for it, and then you proceed from there. And the question is there a different treatment that should be given to African Americans? Maybe, maybe not, but we don't know. And I think that we need to get some answers because there are other populations where there are unique diseases where they've gone after it and shown that this treatment or that treatment works best for them versus the other group of patients. So
Okay.
it's finding answers for ourselves, is my point. Finding answers for ourselves.
Okay, so got two questions.
Mm-hmm.
Let me make sure I go the right direction with it. You are from Montego Bay, Jamaica. That's where
Mm-hmm.
you're from, and you traveled to New York with a host family
Mm-hmm.
that sponsored you, and you found your way so that you could get to school.
Yes.
But the one person who influenced you the most was your mom.
Mm-hmm. Mm-hmm. Yes.
And even during your time with your mom and watching her as a nurse, you yourself experienced a situation with your own personal health.
Yes.
And it was interesting that the way you stated it, you said now you can say you can possibly diagnose yourself because you thought it was osteomyelitis, I think
That's
it
correct.
was.
That's what I think it is.
Yeah.
So,
Do you think that had a great influence, not just your mom, but her experiences were vast? I mean,
yes.
like really vast, which you had a chance to experience seeing some of the things that she was seeing. And you really didn't want to leave Jamaica, but she was like, "Hun, I really want you to go outside this place. I want you to learn more."
Yes.
Do you
Mhm.
think that led to your direction to be a hematologist, to go into oncology?
What I saw in my mom as a nurse was dedication, the commitment to her profession, and sometimes at the sacrifice of her own family as a midwife in a very, very rural area where a hospital was very far away. So that shaped my thinking to wanting to become a physician. I wouldn't say that it shaped my thinking to become an oncologist because at the time, I didn't see any cancer patient. I didn't know what cancer was. Another piece I should say that shaped me was the fact that I myself, I think is what you're getting at.
Mm-hmm.
I was quite sick for months at a time in the hospital as a 10, 11-year-old kid. And I saw more than a 10, 11-year-old kid should see because I was in a grown up ward. I was not in a pediatric ward. I was in a grown up. And I heard conversations that I should not hear as a 10, 11-year-old. But the piece that really got to me was this particular orthopedic surgeon who saw me as a human being and did not see my right hip where the problem was only. He did what he could to fix that problem over time. But he saw me. And one of the things that he saw was a young kid who needed to go to high school. In order to go to high school, it wasn't a given. You had to win a scholarship. And the time for sitting the scholarship exams was gone. And he says, I want this kid to talk to the Minister of Education and ensure that he gets a shot.
Mm.
Those things that I saw, and the fact that I saw people die as a young boy
Mhm.
because there was no doctor in a particular, more rural hospital than the one that I was in, because I was transferred there to wait and to rest. And I thought, my God, in fact, as an 11-year-old, I saw that. And I remember writing a letter to the administration as a sick kid saying, this is crazy. I mean, I said other things, but essentially I said this was crazy. So I think what I'm saying is that I want to be a doctor, but I realized that it's more than just a matter of diagnosis and treatment. You had to see people. So when I had a good fortune of coming here and becoming a physician, I saw it more than just a profession. I saw it more than having an MD. I saw it more than just prestige. I saw it more than, he's smart and, he has risen above whatever. I
Mhm.
saw it as a point of service. I saw it as a point of giving back. And, when I talk
Mhm.
about in the book how that giving back worked itself out, if you could give me another minute, the oncology piece came a lot later because I had no intentions of becoming an oncologist, zero.
Wow.
It was not on my radar. And in fact, as an intern in Buffalo, I remember having to administer chemotherapy to a woman, and she was so frail and she was so sick. And I thought, who wants to be that kind of doctor? I want to go in a different direction.
Mm.
So when I did my fellowship, which is hematology and oncology, I wanted to focus on sickle cell disease. I wanted to focus on the things where people were sick, but they weren't necessarily dying. And a light switch went on in my head while I was in training at George Washington University, where I began to see, based on my professors who taught me, that you don't necessarily have to see that sick person as potentially dying. What
Mm.
you need to do, Fitzroy, is to enter into research to find answers so the next person that comes along, you can do even better for them than the one that you're taking care of now. And
Mm.
suddenly that opened up a whole different conversation for me compared to what I went into the training with. So it became this thing where it was research, it was
Hmm.
caring, and it was reaching for something more than was actually there.
I like that. The reason I brought it to that stint is because you go into the role of fear and denial,
Mm-hmm.
which has a greater impact on cancer outcomes than many may realize.
Mm-hmm. Mm-hmm.
You even pull that out of the words and make sure it is known and is quoted in your book. It is on page 132 if anyone has his book. According to the American Cancer Society, Black women have a lower incidence of breast cancer compared to the majority population. However, the outcomes trend worse compared to the majority population. And the reason I stated that is because I wanted to take it to your influence. I wanted to take it to your unfortunate illness and now kind of self diagnosing possibly osteomyelitis
Mm-hmm.
and your happenstance of how you ended up in oncology. But you also had a lot of issues getting to the directions where you were going
Mm-hmm.
based off of your book,
Mm-hmm.
and that the role of fear and denial as a human can
Mm-hmm.
impact how one may perceive or receive their news. And that's the
Yes.
reason why I want you to just elaborate a touch about the role of fear, because you
Mm-hmm.
even use Miss TM's story
Mm-hmm.
in it as well.
Yeah, so fear is a interesting emotion. We all have it. I have fear of heights. I don't like driving up mountainsides. So let me just say that. So that's one of my fears. And I
Okay.
think other people have other fears. And I
Yes.
think of all the illnesses that we can think of, in my mind, cancer is sort of the top of the heap. I mentioned a book written by not a colleague of mine. I don't know him, but he's at Columbia University, an oncologist. And the title of the book is Cancer, the Emperor of All Maladies. And that says a lot to me because I think everyone, every society in the United Kingdom, in America, cancer holds this dread because it means if I have cancer, I'm going to die,
Mm-hmm.
at least in people's minds.
Mm-hmm.
And so it makes you do very strange things. Sometimes it makes you run to the best doctor you possibly can find.
Mm-hmm.
Sometimes it makes you run away from any doctor. Sometimes it drives you to prayer, prayer only, or some other means of addressing this. And in part because you believe that not much can be done about it.
Mm-hmm.
And part of what I am trying to tell us is we have come a long way. I don't want to deceive you. I don't want to tell you that all cancers are curable, not at this point. But I'm saying that we have come such a long way that you need to give yourself a reasonable shot. And
Mm-hmm.
you need to begin to talk about it. And it has a name. And you need to speak the name as a means of beginning to deal with it. Some people are so afraid of it that they cannot even say the word. And I think that we need to move beyond that. I have seen patients while I was at Howard, because sometimes it might be a genetically based cancer. I'll say to them, in terms of my taking the history, so who else in your family had cancer? And if there was cancer, what kind of cancers did they get? Because you could give me insights into what's going on now. And a lot of times they didn't know their family history. They did
Mm.
not know their family history. So a lot of people in DC are from Virginia and North Carolina, like my wife's parents. My wife's mom is from Virginia, Surrey, and her dad was from Greenville, North Carolina. So a lot of
Mm.
people do. So I'm having these conversations. They would say things to me like, I remember when I was a teenager, I heard whispering in the background, but I don't know what they were talking about.
Yes.
It might have been cancer, but I can't be sure because nobody, you're a kid, you're a child, nobody wants to scare you, nobody wants to talk about it.
Mhm.
So
Mhm.
then you have this deficit of knowledge that could be very informative in terms of how you get treated. You have a deficit of knowledge in terms of whether or not you go for screening or not.
Yes.
Speaking of prevention, you have a deficit in terms of a sense of hope because if they were whispering and talking behind your back and not sharing with you, that somehow transmits to you over generations and you behave the same way and you think it's hopeless. And if you don't know that the last 50 years, there's been this revolution in care, then what you live with is the fear and not the hope that something can be done.
And that's why I wanted to bring that up. In our community, I don't like calling it, but we hold secrets.
Mm,
I'm not
mm,
saying that it doesn't happen to other communities, but some of the secrets that we hold back can be detrimental because it could really help the
yes,
process.
yes.
And that's why I wanted to bring up the role of fear and denial. It was interesting in your book, you talked about how one person was concentrating on their shoulder pain, I think it was,
Oh, yes, yes, yes.
and they just didn't want to hear anything else.
Believe me, this was 20 plus years ago. And it was like yesterday for me because it was so
Wow.
painful. 25 years old, 25,
Mm.
single parent, black woman, breaks her arm. I was going to call the chapter Banana Peel
Oh, were you really?
because
That would have been perfect. I mean, seriously, after I read it, that would have made sense to me.
yes. Thank you. She said she was coming downstairs and she stepped in the banana peel and she broke her arm. And so she went to the hospital. And the doctors took the x rays. The arm was broken, but they knew something else was going on. What she had was a pathologic fracture. 25 years old, slipping in a banana peel, yeah, you might break your wrist, but you don't break your arm because you're young, you're strong, your bones are tough.
Mm-hmm.
So she broke her arm because the cancer had already spread to her bones. So she had what we call a pathologic fracture. They sent her to us at Howard with a presumed diagnosis of breast cancer.
Mm-hmm.
I walk into the room with her and I say, "So why are you here to see me?" And she says, "I broke my arm and I want that fixed."
Mm-hmm.
And I asked her to take her shirt off, and it was very obvious what was going on. 25 years old. I don't blame her for it. I didn't want her to feel guilty about it.
Mm-hmm.
I just recognize, I think, what is going on. She's 25 years old. She's a single mom. She's got a kid who is young. She has to support this kid. She can't possibly have cancer in her mind. It
Mm-hmm.
cannot be cancer because cancer doesn't happen to a 25-year-old. And it can't be cancer because who's going to take care of my kid?
Right.
So you live in this world of denial when the evidence is right before you. And believe me, this still makes me so sad because
Mm-hmm.
she's 25. Makes you sad anyway. But if she were 60, 70, 80 years old, the emotions might be a little bit different for me.
Yes.
And I could understand where she was coming from. And what she
Mm-hmm.
had was another type of breast cancer that is not unique, but seen at a much higher rate in the African American community of women.
Is that the TNBC?
Triple negative breast cancer.
Yeah.
And the story with that, she was classic, and that's why I put it in the book. She was younger than the average population to have this disease. She came in with stage 4 disease at the first presentation. You know, you go through stage 1, 2, 3, 4. She came in at stage 4.
Wow.
So there's better treatment now, which is, again, speaking to the whole business of the changes that are taking place. So she had the classic example of what you'd expect to see in a young Black female population with that type of breast cancer. And the outcomes, if you would, is not good. So she had a poor outcome. I knew that when I saw her. And part of my appeal is, why is it that it seems so predominant, that subtype of breast cancer? There's some reasons, there's some thinking behind that. But we need to know more. We need to ask ourselves questions in the biotech industry. Do we need to design chemotherapy drugs? Let me take the word chemotherapy back, because we're moving away from chemotherapy now to biologics, where the side effects are different, but not as terrifying as it was when I was in practice, with the nausea, the vomiting, the hair loss. Those things are beginning to change. And that's another part of the message I want to sort of get out.
It's in his book, and he talks about it where triple negative breast cancer is one of the most aggressive breast cancer subtypes. It traditionally does not respond well to chemotherapy, estrogen therapy, or some of the more standard therapies administered to women diagnosed with breast cancer. And I brought that up because I wanted to show the connection of everything that you're doing. This book hit me to the home regarding clinical trials. And I'm saying this on Cold Press Conversations so that others can hear it, along with Dr. Dawkins as well. My mother went into surgery for kidney cancer. Okay. That's normally a quick operable type of cancer, where the recovery rate is pretty high. Unfortunately, she did not pull through unexpectedly. But where I'm getting at is that over the years of knowing my mother, she believed in being a participant in clinical trials.
It's great to hear that. Great to hear that.
And I'm saying this because I received a notice. I wish I had the name with me talking to you and doing this. It was a clinical trial for Black women. I believe it was somewhere near Boston area. And she was part of this clinical trial. They told me how many years she had been a part of it. I mean, we're not talking about 1 or 2. We're talking about like a decade plus. And they asked for an update. How are you doing, Julia? And I wrote back because I said, I know they'll get this. And I told them they wished me well. They wanted to know what happened because it has to be part of the clinical trial. And that just warmed my heart, because no matter what, even when I was young, under the age of 10, knowing she was still part of clinical trials all the way until her death, she wanted to contribute because she understood the message that we need to give for African Americans. Of we need to be a part of the trials, because the only way we know whether or not that particular drug or that particular treatment will work. It doesn't even have to be a treatment. It also deals with care collectively.
Yes, yes, yes.
I think that's one of your messages as well. It's our care. And a lot of people don't realize that when they have an allergic reaction to a drug, they have a way that they can report it as well as a citizen, that this drug, they had an allergic reaction. Even though the physician is still supposed to put it in there, they themselves as the patient can still do the same thing.
Yes.
And I think where you're getting at, and if I'm wrong, please correct me, your book is there to help us become more aware of what our options are and how we can be best advocates for ourselves.
I think there's the word, advocate. We need to advocate for ourselves. I think the government has done a lot of bad things. So we need to, Tuskegee was sponsored by our government, right? But Bill Clinton also gave an apology back in the 1990s to the collective us about what was done. And they continue to do things. And in fact, Tuskegee changed so many things for the better. The informed consent, the ability for the patient to get redress from the doctor if the doctor treats them without their consent, and so on. But the advocacy, the self advocacy, the willingness to sort of say, you have not offered me a clinical trial, Dr. Dawkins, but I want to be part because I understand that with clinical trials, I'll be monitored more closely, my symptoms will be addressed, things can be done for me that
Mhm.
ordinarily in a 20-minute doctor visit I may not get. So there are benefits there. I want to participate in a clinical trial, Dr. Dawkins, even if you think that I don't understand. Make me understand. Help me to understand because I'm doing this for me. I'm doing this for my kids. I'm doing this for my community. You can help to solve the problem, but I have to be immersed in the solution finding process. And I don't want you to disrespect me because you don't think I'll understand. I
Mhm.
don't want you to disrespect me because you think that I may walk away from a clinical trial. I understand very well. Thank you, Dr. Dawkins. And if you don't help me, I'm going to go to another doctor who may have a clinical trial that may help me. And how do I find out about clinical trials? Because my taxpayer dollars is paying for the National Institutes of Health, the National Cancer Institute, to
Mhm.
put down on the website all the clinical trials that are being done in the United States.
Clinicaltrials.gov, I think it is.
Clinicaltrials.gov. Those are
Mhm.
my tax dollars, right? And so I'm going to go there. And if you don't respect me because you don't think I'll understand, I'll find somebody else with a clinical trial because I realize that I'm at the end of the road of this, or there's something potentially better out there for me. And I want to have that conversation with that doctor. Thank you so much.
Dr. Dawkins, I think today's episode was enlightening, and I sincerely hope that it reaches many people who have questions in regards to multiple things: research, how they can learn from their physician, how they can learn, not saying Dr. Google, I'm not too keen about Dr. Google, but how they can investigate and learn more about what a clinical trial is. There are
Hmm.
books out there that talk about what exactly is a clinical trial.
Hmm.
Before they even do clinical trials, they have to have an IRB. And I'll
Yes,
go into that much later. There are processes that have been put in place because of the situations that have occurred
yes,
with the human. But you have given so much information in your book. I'm telling you, we could probably talk for another 2, 3 hours based off of the information that you have. But I wanted them to see it from your youth to your adulthood and to how you're spreading the word and working with the community.
yes.
And that's the reason why I had this today. And I thank you.
And I thank you so much. I was very fortunate that we found each other on the
Yes.
web. And
Yeah.
I cannot tell you how much I appreciate that because above and beyond the book itself, sales,
Mhm.
what have you, it's the content that I'm interested in. It's the conversation I want to stimulate and even to irritate within the African American community. If you
Mhm.
don't like the book, that's fine too, but at least I want to start the conversation and have you rethink, have us rethink how we think about clinical trials, how we think about our health, and ask ourselves to give ourselves a shot by not hiding our head in the sand, but to rise up and to say, I too am an American and I need to have everything accessible to me that any other American has. And I
Yeah.
think if we take that attitude and take that position, I think we will see in our children's generation, if not in ours, a new day in health. So thank you so much.
When you said children's generation, it made me think of a Bible verse. So we'll move forward. Because the way we act and the way we do, we wanted to reach our children and our children's children.
Yes,
Um,
yes, yes.
y'all have to pardon my tags. I'm a tag queen. I highlight. I do everything when I get a book. But this is Dr. Fitzroy Dawkins' book. He is a medical physician. He's a medical doctor, medical oncologist, hematologist, biotech individual, and of course, an author. You can get his book on Amazon. I just want to say thank you so much. But before you leave, I always have to ask the wonderful question. This is Cold Press Conversations. We had an opportunity to truly squeeze out all the juice, all the good nutrients of what you're giving. What would you like to have if you had a chance to order a cold press juice? What would you like to have? Like, what kind of flavors do you like? Do you like celery, carrots? When it's juiced, what do you like most?
Well, I tell you something that I would like. From growing up in my youth, we would have a combination. If you allow me to,
Okay, go for it. And that's the reason I really wanted to ask you because you're from Jamaica and y'all have some good fruits down there. Okay, so let's go.
I would juice carrots and red beets and mix them together with some condensed milk.
Really?
Oh yeah, that was almost like a Sunday special for, we also had big Sunday dinners, right? And
Yeah.
so combination of carrot juice and red beets,
Mm,
the juice mixed together gives you this beautiful color. You may
mm.
put some lime in it, so a touch of lime. You can drink it as is, or you could put something that, condensed milk. We sort of grew up in the tropics. We grew
Yeah,
up with this British system. So it had to be sweet. I'm not sure that I want to advocate that,
right.
but those two juices together, I remember that very well. And I still do that from time to time here as
Oh,
well.
that's
So thank you.
beautiful. Oh, I
Yeah,
love it. Okay.
absolutely.
You're the second person talked about beets lately, so I'm gonna have to buy me some fresh beets.
Got to get some carrots.
Oh, I got plenty of them. I like them. I eat them a lot. Celery and carrots are my faves. It's pretty bad. My partner even said, "Are you bringing that celery out again?" I said, "Yeah, I gotta have my celery. Sorry about it."
Celery.
But Dr. Dawkins, it's been a pleasure. Thank you so much for even joining me today. I really thank you.
And I thank you for the opportunity to talk to you and to talk to the African American community, bringing a message of hope, a message that things can get better, but we need to advocate for ourselves. Thank you so much.
You're welcome. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.